No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. Today we look into the second episode of the four-part series on heart disease. In the first episode, we had seen what is heart disease, what causes it, and generally what is in the mind of the public with respect to heart disease. In this episode, we look at what are the latest and current treatments available for heart disease. The first question to Dr. Jolie is why are these heart diseases growing so commonly now? And generally, what are the common treatments available?
Heart disease is growing because of our lifestyle. It's a lifestyle disease, and the lifestyle is because of the sedentary lifestyle, and because of our food factors. It is very changed. The new food is very much different from the older generation. So that is the reason for the increase. Then, when we come to the treatment, when the heart disease, there are three types, generally four types of treatment. That is, one is the lifestyle correction. If it is in the early stage, the heart disease is diagnosed as a hypertension. If you have diabetes or hypertension, definitely it is going to progress, or the dyslipidemia, the high cholesterol or triglyceride is there. It will gradually going into increasing, going for a heart attack and things like that. So, but no one is thinking like that. It is diabetes, hypertension. Just eat one or more medicine, and that is not effective. You add more and more medication, and the cholesterol. The result only medication. This dyslipidemia part. Only the medication is there for the cholesterol, not for the triglyceride or any other part. So we always talk about the cholesterol, because modern medicine also, when we are when we have a solution, or when we are medication only, we talk about that. So actually, it is more troublesome is the triglyceride, but we are not able to do much about the triglyceride. So we are always focusing on the cholesterol. So cholesterol actually is a needed thing, but we are blocking that. And if you are very heavy dose of statin, definitely we can reduce the cholesterol level. But we are blocking an essential, the production of an essential thing in the body. This cholesterol is needed for your sex hormones, the steroid hormones, and blood pressure controlling hormone called mineralocorticoids, and also even the vitamin D. It's one of the essential vitamin D for the higher production of the vitamin D from the sunrise. So many things are needed, but we are blocking that with the cholesterol, because this statin and all is come into the play into the medical field. It is very old. So that time we are not understanding that this the importance of cholesterol and all. Even the cell wall is made, cell membrane. It is the integrity of cell is maintained by the cholesterol. But now, for the last many years, it is a norm in the thing that to reduce the cholesterol actually. So one of the main medicine which is given is the cholesterol medicine. Next is the major medicine which is given for the heart disease is the blood thinners like aspirin and clopidogrel. So that also actually it is anti-inflammatory. Actually, that blood clotting mechanism is paralyzed in with that. So the risk is that, what is the risk about paralyzing this or inhibiting the blood clotting? It is a natural thing. The blood clot has to happen, but because of the plaque, if it is ruptured, clot can form in that area. And if it is in the heart, it is very narrow vessel, and the block can occur, and it can give a heart attack. But the problem with that is that when you are taking, if you are hypertensive also, if you are missing a dose, and the hypertension, even if there is 3 times medication, we may not be able to, no one will be able to take it in the correct time. And if you are in a problem, you may not have the medication at all at your hand. So when you are regularly taking medicine and you are making skipping few doses, between the blood can shoot up, and blood pressure can shoot up, and it can make a hemorrhagic stroke. That is the most important danger. And also, if you, after using this blood thinners, if you meeting an accident and get a hit on your head, there also can be bleeding inside the brain, and it can also create problem. And also, any road traffic accident or any other accident, if bleeding, the bleeding will not be stopped. So that is a risk actually. So even if you are protecting the trying to get out of the heart attack, with some of these measures, it is not truly a solution actually. Next is another medicine which can be, that is basically this statins for reducing the cholesterol and blood thinners, and the anti-hypertensive medicine. And definitely if you are having diabetes, for the diabetic medicines. And then what is the medication? Usually there is not much of the medicines. Then is the stent, the next line of medical management. Then this interventional cardiology. In that, this PCI or stenting, balloon angioplasty is there, and the stent, applying stent is there. There also, the problem is, it is only the blood vessel is there in all your body, around 60,000 miles is there. But you are applying only 1.5 to 2 centimeters. That is the length of a stent. Only that part is taken care. So it is only a temporary. It's only pushing the fat aside. That is the only thing that stent can do. And bypass surgery, what is happening? You are taking a blood vessel from your leg, or usually from the leg. So vein is taken. Artery cannot be taken. So the vein is taken, and it is used as a bypass to the connected to the aorta, that is the major great vessel, and to the part where the block was seen, to the coronary artery where the major block. Further that, there is no blood flow or reduced blood flow. In that part, you are applying this uh, stitching up this blood vessel from the leg collected. We are calling it harvesting the blood vessel. And these harvested blood vessels will be connected to the aorta, major great vessel, which is coming out of the heart, and to the part which is seen inside this angiogram where it is blocked. But there is no surety, there is no, we are not, the doctor also doesn't know that what is the condition of the blood vessel after that. If it's a long time, it can be narrowed, or there also can be atherosclerotic, and we don't know whether the flow is reconnected or anything. And also there is, because all these procedures are very invasive and very can create problems. So we will not going for before the bypass surgery, there will be an angiogram will be done. But no one is doing an angiogram after the bypass surgery, after 3 months or nothing like that. So we don't know what is actually benefiting, or really it is useful also.
Generally, people have a feeling that stents or bypass are life-saving procedures. That means that stent has actually saved the person's life, or the bypass has saved the person's life. That is the general feeling in patients and also caregivers like others. At the same time, we also hear like, if you have 90% block, means the patient thinks he is 90% dead or something like that. So the general communication is very confusing. So when the patient or the or his supporters, caregivers, and all reach the hospital, generally it is a very stressful time where, if this doesn't happen, that is it. So everyone associates commonly bypass and stent with emergency. That is, if a talk of stent or bypass is done, that means it's an emergency. Uh, what can you say on that?
See, previously there was when these heart surgeries are all come, there was only initially there was a bypass surgery, but it was done in a very few centers only. And after that only this the technical development is came, and then this intravascular catheterization and putting stent has developed. In that time also, then another, if you are getting actually the heart attack, usually when you are going with the pain in the heart, and you are advised for a angiogram immediate, that is actually previously you are olden days, actually the patient is get stabilized, and then only think of any of these alternatives. Nowadays, if you are getting in a heart pain at the midnight also, when you get in the hospital, if it's a hospital with a cath lab and interventional cardiac facility, and in most of the world, I think in our part of the country, Then Kerala, there are even in the most of the villages there are facilities with the cath lab and facilities are there. So if the primary angiography is the norm actually. When you are doing an angiogram, if there is a block, put the stent. That is the norm at the current thing. But if you are not able to put a stent, then you will be asked for a bypass surgery. For the bypass, it will take anyway at least after 1 month, or if it's a private hospital, you may get a very fast appointment and be there. But in other hospitals in the government sector and all, you may be put in the waiting list. That itself shows it is not an emergency. So it is more complicated. Patient is waiting for this thing. And I remember one of my patients is saying that, doctor, I was told that my heart is blocked to 90%, and with the angiogram. And I was not convinced because I didn't have any, only that time I had some discomfort, and I went to the hospital. And this person specifically was the one who was the banker for this setting of the coronary artery units itself. So he has gone to the same hospital. They said that he was telling me that the hospital was said that this doctors have said that 90% block is there. But I was not convinced, so I didn't do the surgery. And then he is willing for the lifestyle correction, and after that he is living without any problem actually. So that is the thing. So 90% means if there is a block, there is a natural, there will be bypass happening inside your body, inside your heart. That is the body's repair mechanism. Even if there is a block on the coronary artery or any artery, if the body gets time, if it is not a sudden block with a clot, it is different. But even if there is 90% block, the body will be adjusted, and there will be small blood vessels will be there, and the coronary artery will be that part of the coronary artery will be bypassed by the other blood vessel. That is a mechanism of the body. That is why it is there is no corona stent or this thing can really save. But only one condition there can be a possibility, that is a clot is forming in a coronary artery, but there is not much facility for removing the clot. But we have a medication. We are actually previously we were using only medications to this STEMI, that is ST segment, that particular type of ECG changes which is has seen in the this ECG, that is called a STEMI and non-STEMI. Two type of heart attack is there. In STEMI, usually we put a medicine to lyse the clot. The clot will be lysed by the because of this medicine itself. That was the treatment previously given. But because of the more and more cath units and the coronary interventional facilities are available, going for this stenting and all. But there are other measures to do, and there is risk also. That is the thing. When the patient is sick and the heart is in a very sick situation, there is risk also involved in the doing stenting also. That patients also should be aware of that. And primarily, you are able to, if you are willing to, initial stage, if you just you should be in the coronary unit, heart unit, and get, because the arrhythmias can create problem. To prevent arrhythmias, take medication and get stable. And if at all you are going for a angiography or stenting or bypass surgery, first stabilize the patient. That was the earlier norms, but it is changing nowadays because so many reasons. So the patient should be aware that you have to get stabilized and then think of what to do and give consent for whatever is all the options. You should always consider this lifestyle correction, medication, stent, and bypass surgery. All this, most important is whatever is most important is lifestyle correction.
And nowadays, it happens that, some patients at least think that is this medication for my heart issues preparing me for a stent or for a bypass in the future? What exactly it is doing? Because most of these people at the end of a few years of medication, they end up with stent and bypass. So what is it that medications are doing?
See, medications, the modern medicine, we have only this for the heart problems, the statin is there, blood thinners are there, antihypertensive are there, anti-diabetic medications are there. It is the only thing which is we can offer. The patient, why this? The doctors are offering this because the patient is not doing the lifestyle correction, and they don't know what is to be done, and also there is no programmed way for lifestyle correction offered to the patient. There, the doctors will ask you, you reduce the weight and reduce the carbohydrate, if the diabetic, control your sugar. All these things they will be asked, but there is no controlled measures for that, or there is no program is offered to the patient. In my experience, I'm actually this clinically supported lifestyle correction. In that, we are very clear roadmap is there. You had to do this exercise, it's only lying down position. You can do the exercise even comfortably in the bed. You can do the exercises which we are teaching, and also food. Also, we are you had to ensure all the nutrition in the correct format, but a low carbohydrate and low fat diet. But the omega 3 should be, that is the healing fat. The omega 3s should be given in the enough, this thing, enough quantity should be there, because almost all these patients with inflammatory diseases, with the diabetes, hypertension, heart disease, etc., the omega 3 fat, that is the anti-inflammatory, will be low, very low in the body, and omega 6 fat, that is inflammatory, will be high in the body. And almost all these medications what we are giving is anti-inflammatory. So to balance that, if such a diet is given, almost all the patients, if it is a type 2 diabetes, we can stop the diabetic medicine in the first day itself, and we can follow the blood sugar, just not blindly stopping. And every day 4 times blood sugar is checked, or with this continuous monitoring facilities. Now many of the patients are using that. They can see the blood sugar, and it will be controlled. If you are following within 24 hours, blood sugar will be controlled, and also BP will start coming down, because it's inflammatory. This because of this anti-inflammatory food, that is very high omega 3 diet without any color preservatives and all. This blood sugar and blood pressure also come down, and the cardiac markers like HSCRP, CRP, ESR, all these inflammatory markers, homocysteine, it is one of the marker. All this will come down, and accordingly, when they are coming down, we can reduce the other medications also.
When we are talking about invasive treatment like angioplasty and bypass and all that, generally there is no understanding about any improvement in parameters or which cause these issues. That is, whether any tests are done to know whether any improvements have taken place after this to the causative parameters. Why is that not happening, and why actually no one is seeing that side?
That is the problem of the current scenario, actually, or the medical scenario. That is the problem. Even I am not seeing that even this cardiac markers such as CRP, and even the troponin. Usually, troponin test, that is acute myocardial damage. That is the one of the tests which is done, and the ECG that usually followed up. But this HSCRP, homocysteine, and those tests are not actually used by the cardiologist for the follow, because the problem is the cardiologist can offer only the statin and the blood thinners and the antihypertensive. Those medicines will not reduce the HSCRP, or even the homocysteine can be actually another indicator. And I have not seen any prescription, because I am mostly getting all these cardiac patients from the cardiology, those who are under the undergoing treatment from the cardiology unit. And I'm seeing no one is focusing on that, because they don't. These things can be corrected only by the correct lifestyle, the food changes, and the uh, uh, exercise pattern. This cardiac patients, we cannot go to the gym and do the exercises. When we are seeing so many, even the healthy people who is doing the gym, getting a heart attack and sudden death is reporting. It's very common in our part of the country also. So they should be given moderate exercises. It should not be straining the heart, and the parameters has to be followed, and it should be evidence based. Basically, when we are always the patients are saying that when they come for, if the patient is understanding that what is actually this clinically supported lifestyle correction, and they want to do that, because when they are asked for the bypass surgery and they are understanding that it's a major surgery, and many people who doesn't know that what is bypass surgery also. Every person who is going for the bypass surgery, they should understand that what it is. Actually, the bypass surgery, we are opening this the central bone, that is sternum, that is cut open. It is with a, just like this cutter cutting for the strong things like tile and all. It is cut and separated and opening the heart, and in the again the pericardium, that cardiac lining, which is heart, is again put it in a chamber, that is also cut open, and then you are seeing the cardiac arteries passing over the heart. And actually, in the cardiac, these patients with the heart patients, the arteries also will be filled with fat. That area also filled with fat. Excess fat is there around the cardiac, this coronary artery, and that is why this, even the fat adipose cells covering the coronary arteries are filled, this packed with fat. So there is no place for the fat to be deposited. That is the reason for this. It is deposited inside the coronary artery also. So this major surgery, when this surgery is done, it is actually the cardiac by heart lung machine. The heart is connected to the heart, and lung is connected to the heart lung mission. It is so it is a major surgery, and because of this heart lung mission and the blood clotting mechanism change, actually one blood clotting, for that the heparin, one of the medication, blood thinner is given, even though there can be small micro thrombus can be there, and it can go make a strokes, minor strokes in the brain, and it's one of the complication of the bypass surgery, that minor strokes can occur and the cognitive power of the person can be reduced. So those things also should, every person should be understanding. And generally, this lifestyle correction and all is considered as an alternative medicine. So that is the problem now. So actually, it can be done with a much more evidence-based. And then after the coronary bypass or the stenting, usually this what is the changes, it is not looked into. In clinically supported lifestyle correction for the heart patients, what we are doing is we'll be checking the echocardiogram and also the CIMT, that is carotid intima media thickness. That is a measure of the, we can see how much fat deposits are there in the carotid arteries. And we can recheck it because it is an ultrasound scan. There is no risk involved in that. Not like a repeat angiogram or the coronary CT angiogram, etc. It is a very non-invasive procedure, and you can check. And if the patient is correctly doing it, is atherosclerotic plaque will be reduced. We usually do after 3 months and after 6 months, and even the calcified plaques can be reduced, is removed actually. But for the calcified plaques has to be removed, the patient has to follow the lifestyle correction, and the follow-up also should be there. Usually when the medication is over 3 to 6 months, then many of them will not come for the repeat follow-up, but there are patients who are coming every year to repeat checkup, and they are following the correctly. Even the calcified plaques can be reduced, and we can prove it with the CMT test also.
Generally, the feeling is, cholesterol is a major predictor of future heart attacks and all. So, the treatments generally, the patients think that, if they can control cholesterol, that is the best way in which, their heart can be safe. At the same time, what we understand is that also cholesterol itself, but if you are, even if cholesterol is controlled, but inflammation is high, then you are in serious trouble. That distinction does not come to patients. So you were mentioning about these markers and all that, inflammatory markers and all that. So after this surgery or after this invasive procedure like stent and all that, generally the improvement has to be, according to you, seen across the board. That means even their hormonal imbalances or inflammatory markers, their insulin resistance, and so many other, even their liver function, all these will have to show improvement if it has to be successful. So, if you are looking at it that way, after these interventions, what are the tests that the patients should look forward to?
After the interventions, bypass or this cardiac stenting, no other parameters will be improved. So no doctors is following it. They're actually looking for, ask for blood sugar, and there'll be heavily medications or insulin is given, and antihypertensive, blood thinners, and cholesterol medicine. That is statin. That is the usual medication. And if it is there is arrhythmia or something, there are other medication also will be given. That is the only thing. And no one is following the cardiac markers. That is, I have not seen any patients who are following, because I'm saying I'm not prescribing medicines. I'm only seeing the prescriptions and helping the patients to come out of the medication. So for coming out of the medication, we are always looking into all the, if the troponin. For an example, again, one patient I remember that he was had a heart attack and gone to the hospital and put one stent, and only one stent was put, and he was asked to put one more stent after 1 week. He was put in the hospital itself, and before that second stenting, they had done an echocardiogram and they have found some clot inside the heart. So the doctors said not to do it now. We'll do it after 1 month. And actually, meantime, while he was resting in the ICU, he was the hospital. He was looking into what all other options, and he had found the videos about the heart and this clinically supported lifestyle correction. And he came to me for the before this second study. And when he is coming, actually his troponin was high. He was very heavily diabetic, and his insulin level also very high. And he was taking on insulin injection also. And all the HSCRP was high, the homocysteine was high. Cholesterol was okay because we was on 18 milligram or something, very high dose of statin. His cholesterol was okay, but triglyceride was very high. So he was complaining very tired. He was feeling very tired. He was on so many medicines that had reduced the heartbeat and hypertension. So many medicines. Actually, when we started with the patient, treating the patient, we stopped with all the diabetic medicines in the first day because it is his insulin level is so high. So a person with a high insulin resistance is there. Insulin itself is creating hypertension. Insulin injection or high insulin can create hypertension itself. So it will increasing the workload of the heart. So this patient was actually out of medication. All this actually only by reducing and tapering off all these cardiac medicines, only he was found his energy was back. Within a month, his all medications were stopped. Not just like that. In the second week itself, he came down his troponin. The second or third week itself. We actually, after starting, we checked the eighth day. A patient is again coming for review, and the 15th day again coming for review. By the 15th day, this troponin will be for the acute MI patients after suffering an MI. Usually, if you give the correct nutrition and all, the troponin level will be reduced. Only after troponin and all the cardiac markers like HSCRPs come down, then only we will be reducing the. So all the medicines are follow this accordingly. For this patient, because he's already put one stent and already cardiac clots are there, we cannot reduce any this blood thinness. This is advised to continue with the blood thinness just like that. And that if the patient is put on a stent, all the patients will be very careful that they take the heart this blood thinness regularly, and whenever they travel, they should put it in the 1 month of medicine should be always in the stock also. In an emergency situation, if they don't have the medication for 1 or 2 days, the clot formation on the stent, and it can give a massive cardiac heart attack also. So always remember that if you are put on a stent, use the medication, this blood thinners especially, regularly, till according to your cardiologist. Usually after 6 months, the number can be reduced, but you had to continue it for the 1 year. And this patient actually has come out of all this years. He's having autoimmune. He's a very young man. Actually, the reason for his this clot formation and heart attack itself because of an autoimmune disease, and he had having this thyroid problem, and I'm not going into the detail. Anyway, the patient was out of medication within a month, except this blood thinness. And in the after 1 year also, he was telling that I am going. I asked him to follow up with the doctor also, but he was asked for a second stent. So after first or second or third month after he's telling that I'm not going because the doctor will ask me for the second stent also, one more angiogram on putting stent. So he was totally after 1 year also. By the after 1 year, 1 year we reduced the blood thinner also, and now he's I think it is almost 2 years. He's not on any medication. And the diabetes is gone. The most important thing is we'll check the insulin also. Most of the patients with the hyperinsulinemia, within the 8th day itself, the insulin level will come down. Usually come down to normal level. That is the most surprising. Actually, only these things, when we follow up, only we can see what is happening inside the body.
That we come to the end of this second episode in this 4-episode series on heart health. Here we were looking at what are the current treatment options available and also what patients generally miss when they think about their treatment. In the next and third episode, we look at the complications of heart disease and also the associated other diseases that are often seen along with heart disease. Thank you. The informed patient is key to treatment success.